All right, good afternoon, everyone. How's everyone doing? We're going to get started in just a moment. Can the people behind me hear? All right, so speakers are going to have to be nice and loud so everyone can hear. Everyone as best you can. Squeeze in, come on up, squeeze in.
Hello and welcome everybody to our Speak Out for Mental Health. I'd like to ask all the nurses and advocates here to pack in tightly on either side of the podium. Thank you. My name is John Hobby and I am a registered nurse on an integrated health and aging population unit here at Western Psych. I am also a veteran combat medic who served in the Iraqi War and a former City of Pittsburgh paramedic. The reason I went into the Army and trained as a paramedic is that I wanted to serve my country and my community. That same passion for service is what made me decide to become a nurse. I specifically chose psychiatric care because I wanted to help those most underserved who fall through the cracks of the system. And let me be clear, thousands of Pennsylvanians are falling through the cracks, and we are facing an all-out mental health emergency. Western Psych needs to be able to handle this growing catastrophe, but we are struggling with dozens of closed beds, severe understaffing, burnout, and turnover. As one of the only Black male nurses at Western Psych and a Pittsburgh native, I take special pride in providing compassionate, culturally competent care to patients of color. But when we're operating with less than a skeleton crew, it's very difficult to provide the care our patients deserve. On my floor, one wing is completely closed, and the other two have beds closed. During the night shift, nurses are often responsible for 14 patients each. And if we have to go to another part of the hospital to help, one nurse is left with 27 patients with acute mental illness. That's completely exhausting for nurses and unfair to our patients. On my floor, we have patients with feeding tubes, patients going through severe withdrawals. One mistake with these patients can lead to disaster. We have patients with dementia who are combative and need to be talked down. We also have patients who are catatonic and need to be cleaned and turned regularly. If we don't have time for those duties, it can lead to skin breakdown and dangerous bed sores. The chaotic working conditions on my floor are endemic throughout our hospital. Dozens of beds are closed at Western Psych due to understaffing, and we have many unfilled nursing positions. Over the past 3 years, there has been more than 100% turnover rate of staff nurses. Closed beds, reduced access for patients who desperately need treatment, and patients increasingly are not placed on specific units that specialize in their specific diagnosis. This crisis is happening as almost 34% of Pennsylvanians have a mental health or substance use disorder, more than the national rate. In Allegheny County, the rate of overdose deaths is 89% above the rest of the country. When UPMC doesn't invest in us, it makes me and my coworkers feel like executives don't care about mental health professionals or our patients. Much more resources are needed to be focused on addressing the mental health emergency, especially in making sure that Western Pennsylvania's largest behavioral health facility is fully operational. Luckily, my fellow nurses and I have a strong union, and together we are standing up for solutions. I can't imagine what it would be like if we did not have a way to advocate as a union for what we need. So united together, nurses are here today with our community allies to say UPMC needs to invest in retaining, recruiting, and supporting nurses so we can get people the help they urgently need. Now, I would like to introduce our first speaker, Dr. Ken Thompson, a leading psychiatrist in both Western Pennsylvania and nationally.
Can you hear me okay? Good afternoon. It's really good to be here with my nurse fellows and allies and advocates. My name, as you heard, is Ken Thompson. I'm a unionist. I was a proud member of the Committee of Interns and Residents in New York City, now part of SEIU when I was a resident. And I'm a public health community psychiatrist. My job is to serve the people of Allegheny County, to take care of the public, just like the nurses here. I'm honored to be here with you all. I'm especially honored because the truth of the matter is, if I had not had the incredible nurses that I've had working with me over my career, I would never have been able to accomplish any of the things that I was able to do. And it was absolutely dependent on my nursing colleagues. I'm here because I want to do all I can to support this union's leadership in the struggle. We are in a mental health emergency. We were in deep trouble before the pandemic, and it's just gotten worse. We need all hands on deck. Now, for the nurses, I know you guys work really hard. I know you're doing swing shifts. You're sacrificing your families, the time that you have with them to come here and do jobs. I'm sure you're doing overtime. I know you provide real humane care, supporting people in desperate need of recovery. I know that you're underpaid and you're understaffed. I know sometimes you are even at risk of being hurt. I know you want more time to work with your patients, to develop the relationships with them that make it possible for them to heal. I know you want to have time and resources to take care of your families. I know the climate of fear and the threats that exist that keep the doctors and other people who work with you from coming out in support of you. But I know they support you. They just are afraid. It's to your abiding credit that you are not afraid, that you are organized, and that you've stepped forward to tell the truth about what is happening to you and to the people you aspire to care for. You are calling out for support to address our mental health emergency. You are calling out for better pay and working conditions. You are calling out for the sake of your patients and our community. You are asking that all the resources, all the beds, and all the needed staff are available to meet our pressing needs. You want to do the work that needs to be done, and you want to be paid for it and supported in it. You are up against an organization that prefers to use its enormous resources for things like executive jets, leasing luxury jets, or paying somebody who's retired, who'd already made millions and millions of dollars, $18 million. And you have nurses who just would like to be fairly paid for their day at work. There's a whole raft of administrators being paid huge amounts of money, basically to fight you. We have a $1 billion hospital being built right there that is not going to benefit the people of this community. It is not going to improve the health statistics of this community. It's not going to improve the psychiatric care in this community. It's only going to make the people who have a lot of money richer and get more of their cronies richer. While our psychiatric units suffer from bed closures and staffing shortages in the midst of this mental health emergency. Is this truly what UPMC's leadership is about? Why aren't they leading the efforts right now to combat this mental health emergency? What have you heard from them? What are they being paid for? I know what you guys are paid for, and it's not enough. It's past time to realign priorities and assert real leadership in favor of the people. I applaud you for leading us to do that. This is absolutely necessary for Allegheny County, that somebody start this resistance and begin to address the lack of resources going into mental health. I'm so proud of this union for doing that, because I'm really glad to see the politicians here too. I trust that the people of Western Pennsylvania are paying attention. We need them from all their walks of life to support you, because this is about their mental health, about their family's mental health, about our family's mental health, about all of our mental health and well-being. We may not have a lot of money, but we do have solidarity. That's a birthright of being a human being. It's so much more powerful than money when it's mobilized. Our first step to improving our community's mental health is to come together to support you in your struggle and follow your lead. We don't have to live in fear when we all come together. I say especially to the people inside UPMC, this simple fact is, in union there is strength and mental health. Freud said to be a human is to love and to work. I'm going to amend that. This is Ken's amendment. Love, work, and organize. We are standing up. You are standing up for all of us. It's time that we stand with you. Thank you very much.
Thank you, Dr. Thompson. Next up is Dr. Nev Jones, a University of Pittsburgh professor and prominent mental health researcher.
Okay, thanks. It is great to be here. So for a little context, I am an associate professor in the School of Social Work and oversee as primary investigator or co-primary investigator over $10 million in National Institute of Mental Health grants, as well as state level funding, examining mental health services and systems across the United States. Before moving to Pittsburgh about 3.5 years ago, I had worked in mental health systems in a variety of roles, including state level policy leadership, clinical leadership at the mental health agency level, as well as academia, across multiple states, including California, Florida, Illinois, and New York. In moving to Pittsburgh, I was shocked at the state of the mental health system here in an ostensibly progressive state and very progressive county. On what happens when a county disinvests in outpatient mental health services is that they push clients onto the acute and crisis care system. Here in Allegheny County, what we are experiencing is the double whammy of an underdeveloped outpatient mental health system, severe shortages of services, especially impacting those with the most significant long-term mental health challenges and substance use challenges. They get pushed into acute care. Western Psych is by far the largest facility in the county, right? for acute psychiatric care. And meanwhile, from the other end, disinvesting in the nursing workforce and the workforce more broadly at UPMC around behavioral health, creating working conditions that are unsustainable, that shortchange and put clients or patients at risk. And we have these two things converging. So an inadequate workforce and folks who are having forced into acute services because there is not adequate investment outside. There are many, many steps that could be taken, including addressing workforce issues and staffing and pay of nurses, as well as other professional and paraprofessional groups within UPMC, within Western Psych. There is also investment in providers' kind of quality of life and training in other ways. So much, much more significant investment that UPMC could be making in training initiatives, especially in underrepresented areas that could be happening that are not. And these are further signs, right, of a disinvestment in this population, in this community. Just to take this a little bit further, in many other states, we would see substantial investment by primary behavioral health providers in service development and training initiatives to ensure more robust continuums of care. And so that's to reduce the number of people entering into crisis services and to really do a much, much better job of handling discharge from hospitals as people are moving back into the community. We need to make those investments. So in acute care settings, here in inpatient at Western Psych, but also ensuring that people have the services that they need when they get out so that there is not such intense pressure on inpatient providers to fix problems that they cannot possibly solve if the supports are not there in the community. To the union leadership here, I would really, really, really commend the unions for really taking a stand on these issues. I think that greater pressure on UPMC, as well as the county, around behavioral health is long overdue. The community really at this point in time needs to rise up and demand change on multiple fronts. Thank you all.
Thank you, Dr. Jones. Next up, I would like to introduce my coworker, Amy Kitty.
This crowd is too quiet. What we need is to make a little noise. They can't hear us out here. One of the things, my fellow SEIU brothers, sisters, allies, advocates, what we chant is less suits, more scrubs, less suits. When I say more scrubs, you say less suits and loud. More scrubs.
Less suits.
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 Yay. Gotta get this rolling. Hello. My name's Amy Kenny, and with 37 years of service, I'm the most senior staff nurse at Western Psych. Over the years, I've been on the front lines and witnessed Pennsylvania's mental health emergency get worse and worse. And I've watched with increasing alarm as Western Psych's capacity to handle the crisis has diminished more and more. I've stayed in this job out of a commitment to provide compassionate mental health care to our most underserved population, many of whom have no voice to advocate for themselves. Unfortunately, few nurses stay as long as I have in mental health. Too many leave because of insufficient staff, the often dangerous nature of this work, and inadequate pay. About half the staff nurses at Western Psych have worked here for 3 years or less. My son is a prime example. He was a nurse at Western Psych on the drug and alcohol treatment floor. He loved his job and believed strongly in doing everything he could to help his patients recover from their addiction. But then UPMC started doing something that has become commonplace throughout our hospital. Because of understaffing on other units, they began mixing in patients with other diagnoses on his floor. This practice creates mayhem for both patients and staff because newer nurses often aren't experienced in how to handle different diagnoses. Newer nurses often aren't experienced in how to handle different diagnoses, and few veteran nurses remain. One day, the situation reached a breaking point when my son had to barricade himself inside the nurse's station to protect himself from a violent patient who was threatening his life. After that harrowing experience, my son left his nursing position here for a job with less stress and more safety. A major reason we are so understaffed is that we are seriously undercompensated. We've watched as nurses represented by our union at Allegheny General and most recently West Penn achieved major raises in staffing standards. That's why we're united in our current union contract negotiations with UPMC to win improved nurse-to-patient staffing ratios for each unit, as well as compensation that will retain and recruit staff. It is because of our strong union that we are able to effectively advocate today for what our patients need. All of us must remember that the person sleeping under a bridge is no different than you or me. They may have been laid off, experienced a trauma of war, lost a loved one, or have an addiction and just need the right treatment to get their lives back on track. UPMC must honor and value those in our community who are struggling with mental illness. I repeat, UPMC must honor and value those in our community who are struggling with mental illness. They have $27 billion in revenue and the ability to be a leader in addressing this emergency. Also, UPMC is avoiding paying over $58 million in local property taxes annually from their nonprofit status. If UPMC paid its fair share, the city and county could devote more resources to behavioral health services and supportive housing. With enough resources and investment, we can make more of a difference in our patients' lives and better address the larger mental health crisis. Thank you.
Woo!
More scrubs!
Let's do more scrubs! Let's do more scrubs! Let's do more scrubs! Let's do more scrubs! Let's do.
Thank you, Amy. Next up is a true champion for mental health services, healthcare professionals, Representative Dan Frankel. Representative Frankel is the chair of Pennsylvania's Health Committee and a member of the Mental Health Caucus.
Thank you. I just want to make certain that my colleague gets due credit. Dan Miller, who's representative from here in Allegheny County, is the chair of the Mental Health Caucus, I believe. So, but I represent this community right here in Oakland, and I have know that our communities have relied on Western Psych and UPMC for 25 years. In that time, I've seen a great deal of troubling behavior from UPMC, an organization that enjoys the benefits of nonprofit tax status in exchange for a requirement that they benefit our local populations. There are few institutions in our area better positioned to help our community than the one we are standing in front of today, Western Psychiatric Hospital. Western Psych serves everyone, working to meet the needs of children and adults, rich and poor, individuals with mental health conditions, addiction issues, and neurological disorders. My wife, Debbie, started her career as a licensed social worker here and could imagine no better place to learn how to care for patients with complex needs. But today's Western Psych employees are increasingly suffering for the lack of investment by UPMC. Nurses who work here are the beating heart of the care Western Psych provides, but they are coming to work every day knowing that they will be faced with untenable challenges. They are underpaid, under-resourced, and overworked. Imagine being one of those nurses on their lunch break and scrolling past a headline about UPMC's lease of a $50 million corporate jet, or reading about the $17.8 million paid to former UPMC CEO Jeff Romoff a full year after he retired. Western Psych provides desperately needed services to our communities. These services are the very definition of the community benefit that nonprofit organizations agree to provide in place of taxes. And when our neighbors cannot get the help that they need because this hospital is shedding staff and closing beds, where else do they turn? Too often, there is nowhere else to turn. Western Psych serves everyone, working to meet the needs of children and adults, rich and poor, individuals with mental health conditions and addiction issues, and neurological disorders. And this is something that has to be reinforced. What we're witnessing today here is a pattern that we see repeated throughout the UPMC system. This investment in cannibalization of services that don't create the profit margins that other services do. They need to have a commitment to fulfill their promise as a purely public charity under state law that provides them with tax-exempt benefits by continuing to invest in these services that may not provide the margins that other services do, but that serve our community and the needs of our citizens. So with that, I stand in solidarity with our union, who is so strongly representing the workers here, the nurses that provide these critical services. And I hope that UPMC will finally recognize its obligation. It is sacred obligation to provide services and safety net to our community and the people in need. Thank you so much.
Thank you, Representative Frankel. Now I would like to introduce Dr. Jeffrey Shook, a prominent University of Pittsburgh professor of social work.
Good afternoon, everybody. It's really, truly an honor to be here amongst all of you. You're the folks who really do the work that makes this city, this region, a better place. So I really appreciate it quite a bit. So my name is Jeffrey Shook, and I'm professor of social work at the University of Pittsburgh. My research looks at the intersection of policies, practices in the lives of children, youth, and families. Today, I'm going to focus on two different trends and how they intersect to really provide substantial challenges to the provision of mental and behavioral health services here in the region. The first is that we're seeing an increase in mental and behavioral health issues among both young people and adults. Addressing this increase, what some have labeled a crisis, requires, as my colleague Neb Jones talked about, a continuum of supports and services in communities, schools, and even when necessary, institutional residential settings. Of great concern, however, is the reality that the increase that we've seen in mental and behavioral health challenges have added considerable stress to an already underfunded system. The second trend I want to highlight is the staffing crisis in physical, mental, and behavioral health systems. Over the last 7 years, I have been co-principal investigator of the Pittsburgh Wage Study. Through this study, we have surveyed and interviewed thousands of nurses, social workers, clerical, service, and technical workers in our health and behavioral health systems. Our findings have documented not only the economic challenges faced by healthcare and behavioral health workers, but also the challenges posed by understaffing and the conditions of their employment. For example, One of the biggest findings across every study that we've done is the incredible commitment that these workers have to patient care, to their jobs. This stands out in every conversation that we've had. But at the same time, when we've interviewed workers who have left the workforce, the number one reason they say they've left is because of understaffing, insufficient staffing. 90% of healthcare workers in one survey reported that they did not have enough staff to handle the work. 62% reported having to work more than they should, including overtime and much longer hours than were safe for patient care. Many workers reported that their caseloads were too high for them to provide the quality of care that people needed, and this gave them great pain and distress. Despite the difficulties posed by their jobs, some of the healthcare workers that we've surveyed and interviewed report that they don't make enough to meet their own basic needs, and many were underpaid relative to colleagues elsewhere. We found that rates of depression, anxiety, suicidal ideation, and trauma among healthcare workers were very high, alarmingly high. It is very clear that increases in rates of mental health and behavioral health issues pose considerable challenges to our health and behavioral health systems. Addressing these challenges requires investments in the broader system and programs, as well as in the workers themselves. These investments should include raising pay, enacting and enforcing staffing ratios, and providing healthcare workers with more voice in the decisions that affect them. Thank you.
Thank you, Dr. Shook. Now, I would like to welcome a strong advocate for mental health services and nurses in our community, City Councilwoman Erica Strasburger.
It's always a good day when I get to stand with healthcare workers. My name is Erica Strasburger, and I represent North Oakland, Shadyside, and Squirrel Hill North on Pittsburgh City Council. Given my territory, the state of our healthcare institutions is an immediate concern for my office and for me. Facilities like Western Psych and other hospitals in this area not only treat people I represent, they employ thousands of Pittsburghers who live near and far. And whether you live in my district or elsewhere, if you're someone who works for a healthcare network or a patient who relies on these providers for care, I want you to know that if your livelihood depends on facilities in my district operating properly, I will do everything I can to make those facilities deliver for you. That's why I'm proud to stand here today with allies in government, labor, healthcare, and social work to call attention to the crisis unfolding at Western Psych. I'm here to highlight that inadequate staffing and substandard patient care inflict harms on the people inside and outside the building. Because this isn't an issue that can be isolated to just a population of patients, or even to several hundred nurses. UPMC's inability to properly staff and manage this facility is hurting people all across the city and region. Some of our most vulnerable residents rely on the treatment that Western Psych exists to provide. All kinds of people need this facility. Children, adults, elderly, Pittsburghers, wealthy, middle class, and low income, those who are visibly struggling, and our neighbors who are fighting battles within themselves. We all deserve the lifeline that Western Psych provides. Because no matter who we are or how well we think we might be doing at any given moment, any of us could find ourselves in need of the services these amazing professionals offer. And when people who need Western Psych find themselves turned away due to inadequate staffing, it can be the beginning of a downward spiral that we see play out all too often on our streets. Our social workers perform miracles across the city every day, but we can and must do more to help our neighbors before they find themselves praying for a miracle worker to arrive. I know my colleagues on City Council and I will do everything in our power to ensure we meet and treat people where they are, by working to adequately fund and expand our Reaching Out on the Streets or Roots co-response program to the entire city as quickly as possible, and working with partners to quickly build more transitional housing with wraparound services for our residents, among many other things. But turning the situation around must also involve fair pay and sustainable work conditions for the nurses who care for Western Psych patients. A 3-year turnover rate exceeding 100% does not happen in an environment where workers are properly treated or compensated. We know UPMC has the resources to support these amazing nurses. We're all here today to tell them with one voice, support your employees and support your patients. The city is depending on it. We're all depending on it. Thank you again so much for the people behind me for the work they do every day. Thank you.
Thank you, Councilwoman Strasburger. Next up is Representative Dan Miller, the Pennsylvania House Majority Whip, member of the Autism and Intellectual Disabilities Caucus, and organizer of the Mental Health Summit.
Jesse, are you still here? Jesse, are you still here? All right, listen. I tell you, I want to thank everybody for being here. I want to thank Dan, I want to thank Erica, and I want to thank every one of these nurses who worked 37 years, but still comes out here to fight. She comes out here to fight for everybody who's in here. And by the way, thank you. When we look up here, you know what I see? I see that this building here has 100 beds or so, floor that is empty. And you know what I think about? I think about those who are at home, those who are hanging on, those who are waiting to get in, those who are looking for hope today, those who are hoping to get a little bit stronger today, those who are hoping to feel just a little bit better, a little happier today. They're waiting to get into this building. They're waiting to meet these people. They're waiting to get that help. And they're waiting too long. Now look, from the state, we've made some progress in some areas. And I know somebody said some words about the county. Believe me though, it is not the county that is collapsing the system. It is the state that is allowing it to happen, combined with allies in that effort who sit there with more profits than the state has rainy day funds. I say that again. You have more profits than the state has rainy day funds. But yet we sit here and we say, well, nothing can be done. Look, I'm glad that $1 billion hospital is being built. I'm glad for the workers who are building it. I'm glad for the work that will be done in it. And we want to see that investment. Where is that mental health plan for Allegheny County? Where is that mental health plan for UPMC? We don't need one Western Psych. I need 5 Western Psychs. We don't need 50 of the workers who are here. God bless them for making it. We need another 400 workers to be here. And the state must partner with allies who will get it done. It is difficult when you come up and cry about challenges to your nonprofit status, when you sit there with the funds that can make a difference and you do not. Look, even today, when I left my office, I still had to stay on the phone in between another SEIU helping an employee getting and struggling to get the mental health they need. We have a challenge. Access is a major issue. Whether you're talking inpatient, outpatient, we have a challenge. We still are not attracting enough people to the work. The cost of education is too high. We are in a great place right here at the heart of the University of Pittsburgh. Costs are too high for work that needs to be done. We must do it. Now, if only UPMC had a school that perhaps can help them train and control costs to help fund this industry, that makes a life-saving difference. Look, even as we speak here right now, there are people in this building, some of which, by the way, who are so busy they had to come out and take our pictures, I guess. But there are people in this building who are receiving care, who are struggling to get through this day. And God willing, thanks to the work that's done by these professionals, they're going to come out even stronger than before. But this is not it. This is the tip of an iceberg. We are not seeing really the collapse of a system. We are seeing the dissolution of hope in this state when it comes to making a difference in people's lives. Mental health matters no matter where we are. And if we don't pay for the services, you're going to pay for it a different way. And we all know how important this facility is, but we also know that the #1 facility in this county that provides mental health services is still actually the county jail. Because too many people are washing up there when they're not getting the help they need. Look, there's a lot to be done. What I do know is this. She doesn't work. Is she a nurse? She's been a nurse for over a year. What we know about this, thank you. Look, she's like, I'm not here, but I would be here. Maybe if you pay me more. Maybe. Look, what we do know is this. These people are game changers and lifesavers. You either support them or you're losing lives. UPMC knows this. We know it. It has to be a combined effort to get it done. But we need to have partners who will get it done for them. You can't expect them to do it all on their own. They can't do the work and then find a way to keep the place afloat financially. That's your job. And for those who are sitting there on that board of this important institution, we ask you instead to find a way to come to us with a plan that will invest not just in the people, but in the structure that will get it done. I want to thank SEIU for calling the alarm. I want to thank for the workers who are getting everything there. And for everybody out there who's still getting help, who still needs help, please, 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 do not give up. Do not give up. And keep seeking out help. And it'll be up to us to make sure that someone's there on that phone or in your home or in this facility to get it done. We will be there to fight with you. We just need to be sure UPMC joins us in that fight. Thank you very much.
Thank you, Representative Miller. Also, I'd like to give a shout out to Pittsburgh United and their support. In closing, I want to emphasize that everybody who works at Western Psych is here because we are committed to this underserved population, which is often stigmatized and ostracized. We are fully committed to advocating for them and doing everything we can to make sure they get the care that they deserve. This union will be back at negotiations tomorrow, ready and willing to come to some type of agreement if Western Psych is willing to do it. To support us, please go to supportwesternpsychnurses.org. We are determined to continue bringing attention to the mental health crisis and hold UPMC accountable to our patients and our community. Thank you.